More cases of the Omicron variant are popping up across the country. At least 5 states have reported infections in just the last 2 days. California, Colorado, Minnesota, New York, and Hawaii have all confirmed cases of the new strain. President Biden announced a new strategy Thursday to curb the spread of Omicron. The plan includes updating travel restrictions, providing free at-home testing, and expanding the country's vaccination and booster campaigns. There is still a lot we don't know about the new strain, including whether current vaccines will protect against it. The CEO of pharmaceutical firm BioNTech said an adapted version of the vaccine it developed with Pfizer might be needed. He added that his company would be able to create such a vaccine within a few months. But CDC Director Dr. Rochelle Walensky says right now the best thing people can do to protect themselves is get one of the current shots.
Our recommendations for protecting against COVID remain the same, regardless of the variant. Our best protection against COVID-19 is our proven layered prevention strategies. This includes getting vaccinated if you have not already, and getting a booster dose if you are eligible, along with wearing a mask in public indoor areas, frequently washing your hands, improving ventilation, physical distancing, and increased testing to slow transmission of the virus.
For more on this, I want to bring in Dr. Len Horovitz. He is a pulmonary specialist at Lenox Hill Hospital in New York City. Dr. Horovitz, thanks very much for being with us. So as we said, the CEO of BioNTech suggested an adapted version of the COVID-19 vaccine may be needed to respond to the Omicron variant. Why would we potentially need a different vaccine?
It may well be that the efficacy of the current vaccines is less than the vaccine effectiveness against the Delta variant and the variants we have now. The efficacy right now seems to be about 90–95%. If it falls to that of, let's say, a flu shot, 60 or 70%, that's less effectiveness. Whether the current vaccines will still protect against hospitalization, severe illness, or death remains to be seen. The neutralization studies that will tell us how effective the current vaccines are will take about 10 days to 2 weeks more to complete. And at that time, we'll have a better idea of how effective our current vaccines are and whether we might need to tweak them a bit.
So I know there's still a lot we don't yet understand yet, but do you think that Omicron is going to replace the Delta variant as the most prominent strain?
It seems that every variant that comes along, from the UK variant to the Delta variant, is more transmissible and is the big bully on the block. And so in that respect, it may well be that it becomes more widespread and the dominant strain, just as Delta has become the dominant strain. Whether it will be a more severe illness, it doesn't appear that way at this particular time, but that's still a bit unclear. And of course, the efficacy of our current vaccines will be more clear in 2 weeks.
Well, if Omicron does become the dominant strain and we need a new vaccine for it, should people still bother getting the booster?
Absolutely. The fact is that if the current vaccines are even 60 or 50% efficacy against the Omicron variant, that's still protection. And so vaccination with the current vaccines is still recommended. Boosting, if you're already vaccinated, is definitely recommended. And of course, there are all the public health measures that Dr. Walensky just covered in your last shot there.
And doctor, is COVID going to eventually be like the flu, where each winter season you need a new shot for that particular strain that is most common that year?
It may well be that this virus will be endemic. Even before Omicron, we believe that the virus would be endemic and will be with us as long as we have so many people unvaccinated in this country. And remember, not even 70% of people are fully vaccinated. So we will be dealing with this virus from some time on from the future. The fact that we have a new variant may mean a new vaccine would be the rule every year, or it may just be that the new vaccine or current vaccine would be an annual booster shot, just like the flu shot is an annual shot. So yes, we're probably going to be dealing with vaccination after vaccination.
So we're in the holiday season. It's a time when people typically gather indoors. Last year, health officials warned against large holiday gatherings. Should people follow that guidance again this year?
It's a little bit easier this year because many people are vaccinated. At this time last year, very few people were vaccinated, and we had a tremendous spike from December through February of people who, of course, weren't vaccinated. The fact that people are vaccinated and boosted makes travel more safe. That said, there was a recent recommendation that nobody over 60 considers traveling during the holidays. So that's a little bit of a warning that since we don't know the efficacy of the boosters and the current vaccine, there should be some caution.
All right. Well, Dr. Len Horovitz, thanks very much for sharing your insight and expertise with us. We appreciate it.
Thanks for having me, Elaine.